At this point in time, I'll invite Ms. Parmar, the Paediatric Audiologist, to make her remarks, and subsequently Ms. Emma Judge, the CEO of Sound Seekers, will make her remarks.
For those of you who know me, I am a volunteer paediatric audiologist, and I've been working with Sound Seekers since January within UTH. Sound Seekers is a very, very small UK-based charity, and we work towards delivering practical solutions to support people with hearing loss by enabling them to access healthcare and education. Our aim actually was to create a hearing screening program for children at risk of hearing loss. However, as we all know, there is no point screening if you have no effective follow-up procedure in place. Until now, the only government-housed audiology department can be found within Ndola Teaching Hospital. With the support of Sound Seekers, audio technicians have been assessing hearing and fitting hearing aids there. Here at UTH, we have been assessing hearing within the ear, nose and throat department. Patients are then sent elsewhere for their management of the hearing loss. Therefore, it brings me great joy and relief to be here today to celebrate the opening of the UTH Children's Hearing Clinic within the Children's Hospital here. A clinic that can provide diagnostic hearing assessments to children of all ages and abilities. A clinic that will provide support and information to parents and families and prescribe digital hearing aids to children diagnosed with hearing loss, as well as the necessary follow-up care. I wanted to use this opportunity today to highlight 3 key messages regarding the audiology provision across the country. Number 1 is the need, secondly the now, and third, the next. Firstly, the need. Throughout the year, I have been inundated with patients and health professionals asking about hearing loss, from minors with noise damage to the consequences of medications, the after effects of meningitis and cerebral malaria, chronic untreated ear infection, all sorts of home remedies being used in the ears. Then there's hearing loss with no cause, and then there's one we will all face, aging. There is clearly great need. Secondly, what is happening right now? From day-to-day life, I walk around the hospital and I speak to various people. I introduce myself as an audiologist, and I'm usually met with a blank reaction and ask questions like, what is an audiologist? An audiologist has never been employed within the government hospital setting, and this profession is not yet established in the country, which is similar across Africa. And what about my patients? I have seen many patients so far, and they have been referred from almost every section of this hospital. Over 65% of those children sent to me do indeed have a form of hearing loss. Many have had it for many years and have other complications with health and education. So what next? The diagnosis and treatment of hearing loss requires a multidisciplinary and multi-sectoral approach. A hearing aid, a device used to amplify sound, is powerful, but on its own is not enough. A child with hearing loss and delay in speech development will require speech therapy to grow their language and communication skills. When a child gets a hearing aid, the brain is adapting to sounds, and regular usage of that hearing aid actually changes the neural pathways in the brain to allow them to process sounds more effectively. Seeing as children are mainly at school, spending many hours there, teachers require adequate training and the training tools to give the child the best chances in education. And as for adults, probably quite a few of you will need hearing aids. And when you try it, it will sound really strange. You will require further support to allow you to acclimatise and adjust to the new sense of sound that you will be getting. There will be further psychosocial impacts, and of course the stigma that we all know to follow. The hearing loss itself is invisible to the naked eye, but the consequences of unidentified hearing loss will affect the patient, their family, and the community as a whole. Now there is audiology provision in Ndola and in Lusaka. I believe these can be treated as hubs or centres of excellence to allow the further growth of audiology across the country at a community level. To treat such great need requires human resource and training to build capacity. And I hope events like today can bring awareness of that need. From my experience so far, I am very excited for the future of audiology services in Zambia. I would like to thank all of those who have made me feel so welcome, who have volunteered in the clinic, who have been there when I've needed advice of how to set up the clinic. There are too many to name individually, but I know that you all know who I'm talking about. So finally, we have seen the need, we know the now, and it is our job collectively to plan for the next.